Medical checkup. Most people do not typically have an annual medical examination, which is a requirement for the President of the United States of America. The medical director of the Royal New Zealand College of General Practitioners, Richard Medlicott, says there's a good reason for that. There is no evidence that people who have an annual health check are any better off than those who do not. However, he says it is important to visit your doctor if you have symptoms you are concerned about. You can also take advantage of a range of health checks, tests and vaccines to help you stay healthy. Cardiovascular assessment. A doctor uses a range of measures to calculate your risk of developing cardiovascular disease and diabetes. These include your blood pressure and cholesterol and blood sugar levels. The doctor will also take your family history and assess risk factors such as smoking, obesity, diabetes, and previous high blood pressure. Men aged 45 plus and women aged 55 plus should have a cardiovascular risk assessment every 5 years. Those of Maori, Pacifica, or Indo-Asian descent or with a family history of heart disease or diabetes should start 10 years earlier. If you have a risk score of 10% or higher, your doctor will recommend lifestyle changes, such as getting more exercise and eating better. You might also be prescribed medication to help lower your blood pressure. Bowel cancer screening. 3 district health boards already provide free tests to those aged 60 to 74 under the National Bowel Screening Programme. The Southern DHB will offer the free test this year, followed by 6 other boards by the middle of next year, 5 more in 2019 and 20 financial year, and the last 5 2020-21. The 2-yearly test involves screening for blood in bowel motions. If you have a positive result, you might be referred for a colonoscopy to investigate further. Eligible participants will be contacted once their DHB joins the program. Skin cancer checks. Check your skin every 3 months and see your doctor if you notice a new skin lesion or a mole or freckle that's changed. If you are fair-skinned or work or spend a lot of time outdoors, or you have a lot of moles or a family history of skin cancer, talk to your doctor about whether you need to have regular skin checks at their surgery. Regular mammograms. If you are a woman aged between 45 and 69, you are eligible for a free 2-yearly mammogram through Breast Screening Aotearoa. Younger women with a family history of breast cancer may also be eligible. You should be invited to join the program when you turn 45. Contact the organisation if you have not been contacted. Cervical screening. All New Zealand women aged 20 to 70 are eligible for a 3-yearly smear test for cervical cancer. This will change later this year. The tests will also be offered every 5 years to women aged 25 to 69. The test itself is also changing. Instead of screening for abnormal cell changes, the test will initially screen for the human papillomavirus, HPV, which causes most cases of cervical cancer. Prostate cancer checks. The jury's still out on the value of running national screening programs for prostate cancer. If you are a man aged 50 or more, talk to your doctor about whether you should have a medical examination and a blood test to measure your levels of prostate-specific antigen, PSA, which may indicate you have a prostate tumour. Have the conversation when you are 40 if your father or brother has a prostate cancer. Shingles vaccination. From April, everyone aged 65 or older is eligible for a free dose of shingles vaccine Zostafax if you have had chickenpox as a child, you are at risk of developing shingles when the varicella-zoster virus reactivates, resulting in a painful rash that might cause vision problems and lasting nerve pain.